So good afternoon. So today discuss about the thing is called as an antidepressant. So what is depression? Depression means when the which men are mainly it's suffering from the medical illness. So that is called as an depression. So which drug or which hormone are regulate the depression? So this hormone called as an antidepressant. So these are the unit of antidepressant. So the first is called as an mental illness and another one is called is an the changes of the mood. And now the symptom of the antidepressant activity. So first symptom is the weight loss. Now another is the agitation and another one is the change of the appetite. Now the fourth one is the thought of death. So in the thought of death in antidepressant activity is a very important thing, the unit of antidepressant activity. So some of the medicine or some of the hormone are mainly regulate this decision. Now so first thing is weight loss. So when the antidepressant or depression will be occur in our body, which means suffering are in our body, so this men are mainly suffering from weight loss. Now the agitation. So what is the agitation? Agitation means some of the men will suffer from the depression. So these men are mainly something or the medical illness, that is called as an bipolar disorder. So this is called as an agitation. Now the change of appetite. So change of their behavior and the character, this type of things will be changes are in the antidepressant in the depression activity. Now the types of depression. And now the first is called as a major depression and another one is the chronic depression and third one is the atypical depression. Now another one is called as a bipolar disorder and another one is called as an seasonal depression. So first depression is called as a major depression. So major depression means some of the patient who is suffering from depression. So when some men are mainly exam will retain, so this time will be suffering from depression. So this depression called as the major depression. Now in the chronic depression, which men are suffering from as an oral cancer. So these men suffering from oral cancer. So this type of depression called as an chronic depression. Now the atypical depression means called as a bipolar disorder. Bipolar depression means the atypical depression is equal. Now the seasonal depression. So which means suffering from the session to session. So this depression called as a seasonal depression. Now the hormonal act. So which hormone are act as an antidepressant activity. Now the first hormone called as a dopamine and another one is called as serotonin or another one is called as an noradrenaline, because when the dopamine level will be decreased in our body, the BDNF will be decreasing will be in our body. Now the HPA axis will be increased. So when the HPA axis will be increased in our hypothalamus campus, the limbic peripheral activity will be increased. So when the limbic peripheral activity will be increased, the cortisol hormone will be increased. So when the cortisol hormone will be increased, the depression will be come into our body. So these are the main pathophysiology of the hormonal activity of the antidepressant. Now the serotonin. So which hormone? The serotonin means 5-hydroxytryptamine. So when the serotonin level will be decreased in our body, the cortisol level will be increased. So when the cortisol level will be increased, when the cortisol level will be decreased, so depression activity will be come into in our body. Now another one is called as a noradrenaline. So this mechanism will be same according to the serotonin and the dopamine. Now the pathophysiology of the depression. So first pathophysiology is called as a genetic disorder. Means genetic disorder means which patients suffering from genetically depression activity. So in the 5-HT and the noradrenaline hormone will be decreased, secretion will be decreased in our body, and another one is the BDNF, this type of enzyme will be decreased in our body. So when the BDNF enzyme will be decreased in our body, the HPA axis in the hypothalamus campus present in our brain. So HPA axis will be increased. So when the HPA axis will be increase the cortisol hormone. Cortisol is a stress relief hormone. So HPA will be increased, the cortisol will be increased. Now when the HPA and the cortisol hormone will be increased in our body, now in the hippocampus activity will be increased. So when the hippocampus activity will be increased, the limbic hyperactivity will be open. So when the limbic hyperactivity will be open, the depression will become into our body. So this is the overall pathophysiology of the depression. So this is the unit of the antidepressant. Now the second class will be continue the pharmacological activity of the antidepressant in the medicine of the drug.